Good afternoon and welcome to the UCF Housing Experience Town Hall. My name is Dr. Virginia Cook, and I am Assessment and Research Specialist in the Department of Housing and Residence Life.
Good afternoon. My name is Chantel Carter. I am the Associate Director for the Office of Student Involvement. Together with Virginia, we will be your moderators for today's forum. At this time, we would like to introduce the panelists. First, I would like to introduce you to Dr. James Shout, who's Associate Director for Clinical Services. Next, I would like to introduce Liz Stevenson, Assistant Director for Clinical Services within Counseling and Psychological Services, also known as CAPS. Would like to introduce Wendy Shively, who is the Director of Food Services for Aramark. Crystal Sargent, Marketing Manager for Food Services with Aramark. Dr. Delaine Priest, Associate Vice Provost, Division of Student Learning and Academic Success. Emily Wente, Coordinator, Student Care, Title IX Remedial Measures. Also, Justin Andrade, Assistant Director for Office of Student Involvement. Also, Dr. Kent Butler, Interim Chief Equity, Inclusion, and Diversity Officer. And Curtis Kalai, Student Director for Residence Hall Association. Dr. April Konvalinka, Executive Director for Housing and Residence Life. Peter Mitchell, Director of Housing and Administration and Finance. Arian Bryant, Director of Housing and Residence Life. And Meredith Varner, Associate Director for Housing and Residence Life.
All right, thanks, Chantel. You may want to address some feedback issues that we're hearing while I'm giving the next part. And I want to thank everyone for listening and watching on Zoom today. First, we would like to bring your attention to the Q&A feature featured near the bottom of your screen. Please use the Q&A feature to ask questions, and we will share the panelists. Feel free to designate a specific panelist to answer your question if you would like. Next, please note the upvote option. If you see someone who has already asked a question to which you are interested in hearing a response, you may upvote it. We will give preference to the upvoted questions, followed by questions in the order they were asked. Some questions will be answered in the Q&A window. You will find these responses in the Answered tab. We are simulcasting on UCF's YouTube channel. If any attendees are hearing from others that they are having trouble with Zoom, please direct them to the UCF YouTube channel. The YouTube channel direct link is available at events.ucf.edu. Before we go to the first question, several of our panelists will give quick fall updates from their respective areas. Dr. Konvalinka, can you please start us off by providing a general overview of the purpose of our forum today?
Sure, thank you, Virginia. The purpose of this webinar today is to share what students will experience when living on campus this fall. We are in challenging times due to COVID-19, and the health and well-being of our students is extremely important to us. We have aligned our services with the health and well-being measures and strategies that all students, staff, and faculty must follow to help mitigate the risk of COVID-19. These health and well-being measures include reduced occupancy, required facial coverings, space and amenity limitations, physical distancing and guest restrictions, increased cleaning and disinfection, and encouraging hand washing. As you prepare for the fall, we have brought this panel of experts together to highlight the reality of living on campus and how your respective areas will welcome and support you throughout the year. We are excited to update you as new information becomes available, and we're committed to giving you that information as well, and we're doing so today. This is an exciting time for our residents, and we want to share with you as much information as possible to enable your success. We're excited to have you join us in Night Nation in the fall, and we appreciate your patience as we navigate this new reality. Thank you.
Thank you, Dr. Konvalinka. Now we will move on to our other panelists and their updates on what to expect on campus this fall and changes you can expect due to COVID-19, starting with Dr. Schaus from Student Health Services.
Thank you. Sorry, I had some technical difficulties getting on, but I'm here now. So we're very much looking forward to having our students back on campus, and we have a number of plans to keep everybody safe. We're going to, in terms of the students coming back to us who will be in residence halls, I think the biggest project that we're going to be working on in preparing and preventing COVID on campus will be the testing. And the plans will be to coordinate as the students arrive. I believe the dates are August 8th through August 23rd. And as they arrive, an integral part of the arrival date and the arrival process for each student will be testing. And we're going to arrange testing at Aventis Biolabs, which is on campus currently in Garage A, but we'll be extending that. We're going to have a rather extensive amount of testing by Aventis. And then the test that is going to be conducted will be the very best test that's available, the PCR test. That's the diagnostic test for COVID. And we'll be able to identify those hopefully few students who test positive for COVID will then be quickly identified, and then we'll be able to do the case identification of that first index case, and then putting that person in isolation, and then be able to also do quarantine of any people who might have been exposed to that person. Of course, this is a new arrival, so hopefully there won't be many exposures. What I'd love for our students to begin to think about right now, because it's only a few weeks away, is to do partial quarantine right now, to begin to practice while they're home, to be in face covering at all time, do 6 feet of social isolation, frequent hand washing. Begin to kind of practice that distancing that is so important to preventing the spread. So that's probably the biggest thing, would be the testing, and then the contact tracing and our plans for isolation and quarantine if we should get a few positives.
Thank you, Dr. Schaus. Next, we have Liz Stevenson from Counseling and Psychological Services.
Thank you. Welcome, Knights. Counseling and Psychological Services, also known as CAPS, provides free psychological counseling to all enrolled students and will continue to serve UCF students through telemental health services. Our fall semester hours will continue to be Monday through Thursday, 8 to 6, and Fridays, 8 to 5. We encourage any student interested in connecting with CAPS to contact us to set up an appointment. We also have our after hours crisis services for any after hours, middle of the night, and weekend concerns or issues. We have an extensive website that allows students to be interactive with us, and we are on multiple media platforms, including our own YouTube channel that has served as a great resource for students. CAPS will also continue to offer groups and workshops remotely, including hosting, and currently doing so, our affinity identity discussion groups, safe spaces, with CAPS counselors to discuss racially charged events and issues in our community. We welcome all students to reach out to us with questions, concerns, or to make an appointment.
Thank you, Liz. Next up is an update from our dining services area, either Crystal or Wendy.
Hi, it's Crystal Sargent from Dining Services. I want to share a couple updates from our department. First of all, meal plans are available for sale on our website, ucfdining.com. Most any question that you have about how meal plans work or how to navigate your meal plan can be found there. I also want to let you guys know that there is no deadline to sign up. In this uncertain time, we understand that you guys need that extra time to get your questions answered. So you can sign up for your meal plan anytime before your student arrives. I also want to let you guys know that there are a lot of questions going on about what's going to happen with dining in the fall. And I want to let you know that rest assured, we are putting a lot of thought into how we will reopen and when will we reopen. And so all of these updates will be communicated to you via our website and our social media channels. We do plan on reopening our dining halls. We will be opening at half capacity at this point, but we'll be following all federal and university guidelines on reopening. We are taking extensive care into how we are preparing our dining halls. We are training our staff on extensive cleaning and hand hygiene practices, as well as following the university's guidance on all social distancing, required mask wearing, and all the other things that we would be doing. We're going to be laying out, social distancing stickers so that your students will be very aware of where they can and cannot linger. And we are also going to be implementing a to-go program where your students will not have to come in and stay in the dining hall any longer than they would want to. I do want to also talk about some really important news that we are happy to share with you guys on this call. We are developing a Wellness 14 meal plan. This meal plan has been designed with our isolated students in mind. So if your student does come in contact with COVID and does test positive and does move into one of the isolation rooms, we are working with housing to have your student opt into what we're calling the Wellness 14 meal plan. This meal plan will provide your student with 3 meals a day for the 14 days that they are in isolation. They will receive a continental breakfast, a boxed lunch, and a hot dinner through this program. Great news is if your student is already on a meal plan, then this service is included in the meal plan they already purchased. We are happy to be able to partner with housing and offer this to your students during this challenging time.
Thank you very much, Crystal. Next up, we will have Dr. Delaine Priest from Student Learning and Academic Success.
Good afternoon and welcome to UCF Nights, graduating class 2024. We're so pleased that you have selected UCF to continue your education. I want to share with you just a few updates as it relates to academic advising and student support services. Let's begin with academic advising. Academic advising is a critical component of your UCF experience. Your academic advisor will assist you with course selection, connection to campus resources, help you create a pathway to a 4-year graduation, and support you in achieving your personal and academic goals. Students, if you have selected a major and have questions regarding your fall course selections, please contact your college advising office. If you have not selected or you're not sure about your major, UCF has a new office to connect you with exploring your major. That office is the Knight Major Exploration and Transition Center, KMETC. So I am encouraging you to follow up with your college advising office or KMETC if you need any type of advising services. Please know for the fall 2021 term. Academic advising appointments will be available remote, by video, phone, and email. Some college advising offices will provide limited in-office appointments. Your safety is our utmost concern, and we will be making sure that we are providing services with you in mind. Please contact your college advising office to determine if they will have in-office appointments for the fall semester. Academic advisors are here to support you. I need for you to really reach out and connect with your academic advisors. They will help you navigate the UCF system with your academics. So please reach out and connect with your advisors. I also want to just make you aware of another resource that is on campus to support you, and that is the Student Academic Resource Center. On campus, it's known as SARC. This fall semester, SARC will offer over 280 hours per week of peer tutoring for 36 courses. In addition, supplemental instruction will support approximately 60 course sections of STEM courses. So if you're a chemistry major, a biology, physics, anatomy, and others, SARC is here to serve you through some supplemental instruction. Fall 2020, SARC will provide online services, but limited in-person tutoring and supplemental instruction services. We are here to serve you. Please connect with us. You can do this by just typing in student success and advising, and you can find this information on the website concerning advising, or type in SARC and you can find information concerning the Learning Center. Welcome to UCF.
Thank you very much, Dr. Priest. Next up, we will have Emily Wente, who will provide information about student care services.
Good afternoon, everyone. So a little bit about student care services. We are a non-clinical case management team on campus that we work to help students navigate difficult situations and connect them to resources. So these resources can include anything such as the counseling center, student health services, the pantry, or a community resource. We also offer education and training related to safety and well-being. We have an outreach through our office called UCF Cares, and it's about building a culture of care on campus. And we encourage you all to follow our social media accounts to find updates and to be connected with us throughout the semester. In regards to COVID-19, we have been working to advocate for students with their professors. We're working very closely with housing, and we also have been offering some emergency funds for financial crisis. We can also help navigate a medical withdrawal or other possible academic support if needed.
Thank you very much, Wendy. Next up, you will hear from Justin Andrade from the Office of Student Involvement.
Welcome, everyone. First, we're excited to provide student programs safely. The Office of Student Involvement, or OSI, is in the process of outlining how we will deliver events. We're creating a slate of opportunities that will range from virtual, hybrid, or a combination of virtual and in-person. And in-person operating within capacity regulation and as well as much smaller scale events. Currently, we're working on fall welcome week events, one of which includes a socially distant drive-in movie. So we're really pumped about that. We're exploring our usual social events as well as educational opportunities via streaming, virtual performers, and virtual service opportunities. This summer, the Campus Activities Board and Late Nights, in partnership with several different campus departments and student organizations, are hosting an onset of virtual programs through July 31st. You can check that out on the OSI website under summer events. Some of these virtual programs have included YouTuber Tyler Oakley, Murder Mystery, Netflix Party, Jeopardy, Bingo Night, an escape room, a DIY planter and cooking event, fitness events, dialogues, and educational programs about leadership and UCF resources. We can't wait to engage with you this fall in a variety of capacities.
Thank you very much, Justin. Appreciate that. Next up, we have Dr. Kent Butler to provide information on how we are continuing to address the needs and efforts toward equity, diversity, and inclusion efforts here at the university.
Greetings, Knights, and good to see that you all are interested in knowing what's going to happen on this campus when you return, or when you arrive, actually. So the Office of Diversity and Inclusion is one that is set up to help students and faculty and staff to be able to navigate the university with regards to feeling included, feeling as though they are a part of the university environment and culture. And so what we do in our office is provide programming, and there will be programming for students and for staff and for faculty with regards to that. One of the things that we're looking forward to this semester is sharing information through town halls about the climate of the university. We had a climate survey that was put out about a couple of months ago rather, and we are analyzing the data, and we are going to be putting that data out to the university community so they can know what the climate is and how people are really feeling about being on our campus. The other thing that is happening through the Office of Diversity and Inclusion is we're going to be putting together a student advisory committee that will advise me of the student concerns that are happening on campus. Therefore, I can be a liaison to the other offices that you're hearing from today with regards to how students are feeling about their interactions here on campus. That's going to be the major focus of the office while we are returning this fall, is to make sure that all students have a voice. And so we're looking for you to be a part of that, to come by and to recognize what we're doing for all students and not just students who are coming from diverse backgrounds. We are actually here to make sure that everyone feels welcome on this campus. So thank you.
Thank you very much, Dr. Butler. Next, we're going to turn our focus to our housing experts, and we'll start specifically with Peter Mitchell.
Good afternoon. It's a pleasure to be here this afternoon. I'd like to give a couple updates, starting with the housing addendum. All students who have an active housing agreement that begins in the fall have been sent a housing addendum. The housing addendum outlines considerations for living on campus and expectations. It needs to be acknowledged by the deadline, and that's to ensure that space will be there for you in the fall. Also, we'll be providing move-in kits that will contain hand sanitizer, face covering, and COVID-19 well-being tips. We have received a great many phone calls and emails regarding payment information and deadlines. I ask that you go to our website before emailing and phone calling, because most of the information you will find out there. Also, just another point that we at this point intend to remain open, even if the university goes fully remote at any point in time.
Thank you very much, Peter. Now we will hear from Meredith Varner, who will provide some information about move-in appointments and room selection. Meredith?
Great, thank you. Good afternoon, everyone. Thanks for joining us. Move-in appointments were launched yesterday in our housing portal. So if you are excited to get your time and date scheduled, you can go ahead and do that. It is down for maintenance right now, but should be up at the end of the day today, if not first thing tomorrow. We did have a lot of folks go in and make their move-in appointments. So thank you for doing that and being on the ball and getting scheduled. We're excited to have you arrive. I do want to give you one quick FAQ that we've been getting a lot, and we want to make sure we're saying it everywhere. You are given a 2-hour window. That is your window to arrive at the university, to go through your testing, to receive your key. You do not have to have all your items in the room by the end of that 2 hours. I know that some folks have been real concerned about that. And we do want to make sure that you know that you do have more time. We want you to move quickly to move your items in so that the next set of folks can come in just like we would during a regular move-in. We would encourage you to take a super duper long time to get everything in your room, but you do practicing how to speed make your bed in 30 seconds so that you can do it. Don't worry, you can relax a little bit. You have more time. Some information about room selection. The vast majority of our students do have the room assignments at this time. Our academic main Incoming freshman students are going through room selection right now, and so that is going on for the next few days. As soon as you choose your room assignment, you will be able to choose a move-in appointment. Move-in appointments are limited by floor or building to ensure some physical distancing, so we don't have a bunch of folks in one elevator at the same time to help with spreading out. So that's why it does have to wait till you have a room assignment. And then you do have to have your addendum acknowledged in order to sign up for a move-in appointment as well. All that being said, if someone does have a specific need, they can contact us. We do want to make sure that we help you out if there's something that's not working for you or not making sense. If you have been, we will be assigning you a room as soon as possible. We're at the point where we are offering to students on our wait list. And so as those students are completing their housing agreements and making their prepayments, we're working to assign them rooms as quickly as we can. Thanks.
Thank you, Meredith. And next up, certainly not least, but we'd love to now hear from Arian Bryant, who will share a little about living in your residence halls. Arian?
Too kind. Good afternoon, everyone. Thank you for joining us. So I have some updates that I would like to share with all of you. Our residence life and education team is working really hard to develop some plans for keeping students engaged and connected in virtual formats. We recognize, because of the uniqueness of this academic year coming up, move-in is going to start a lot earlier. So we want to make sure that we're engaging with our residents and keeping them busy all the way up until classes start and throughout the fall semester. So we're really excited about these creative initiatives that will be taking place in our department and in partnership with many of our sister units across the division and the university. One thing I would like to share with our incoming Knights, our new Knights, our returning Knights and families, it's going to be really important that roommates and community members are engaging with each other in a civil manner. We recognize there's a lot going on, but the experience that we have is going to be directly attributed to how we're working and how we're engaging with each other. So it's important to be respectful of each other's space and belongings, and maintaining really important, positive, productive, communicative roommate relationships. And our staff members are going to be there to help facilitate those processes. Our staff is working hard to prepare for your arrival. You've heard from many people that move-in is going to look a little bit different. Please continue to check our housing website, the UCF mobile app, and your emails for updates as they become available. We're finalizing plans, and the information that we're providing to you is going to give you a very good idea of what you should expect and what you will experience before and upon arrival at your check-in stations. So we encourage you to check all of those mediums regularly for updated information. The move-in module is now available on the mobile app, so we encourage you to download and check that out. And will be updated as we move. Will be updated and continue to be updated as we move closer to move-in. So I did speak a little bit about, and this is where I'll end, about the virtual engagements, because we want to make sure that our residential population is having a wonderful interactive experience, regardless of the changes. All right. The very first important engagement is going to be our welcome to community meeting. So after you move in, your RA, your resident assistant, your housing and residence life staff members who work within the communities, they're going to invite you to a virtual community meeting so that you can meet the RA, your specific RAs of that community, that floor, that community. You'll start meeting your neighbors virtually and learn more about upcoming events and activities that are not only taking place in housing and residence life and in your residential spaces, but what's happening across the campus. So I highly encourage you to participate in this first community meeting, and we look forward to your arrival.
Thank you very much, Arian. And now, just wanting to let you all know, that concludes the introduction and the information that was pre-prepared from our panelists. Now we are going to move on to your questions. Virginia?
All right. The first question we have, it kind of has a few parts here. So I'd like to know, once the student moves into their on-campus residence hall room at their assigned move-in date and time, can they begin living in their room then? Or is there a minimum date that they can begin living permanently in their residence hall room? So once the student has moved in, can they return prior to the start of classes?
Uh-oh, I think
Arian?
would you like me to answer? Yeah, I'd be happy to answer that one. So this is a question that has come up several times where parents and students are saying, okay, after we check in, do we have the option of returning home and then coming back at the start of classes? Our recommendation is this: once you move in, you should stay with us. And the reason for that is you're going to be tested upon arrival here. You're going to be tested for COVID-19 as we work closely with our student health services colleagues. And we have a better, we feel better about residents staying with us once they move in and practicing and adhering to the education and guidance that we will provide to them upon moving in when it comes to maintaining 6-foot social distancing, wearing their mask, washing their hands, all of the guidance that you've been hearing from health professionals. So our recommendation is once you check in, we would like residents to stay here with us. Because if residents and parents decide to go back home, right, for that period of time, we can't control for it. Now there's a lot of unknowns when it comes to exposure there. So the initial test that you received on campus really weighs a little bit less. So our recommendation, at least for the first 14 days when people move in, is that you stay with us so we understand and we have a good idea of what all of our residents' exposures are, and we can get really accurate test results. So that is our recommendation, and we're hoping that parents and residents can adhere to them.
Thank you so much, Arian, for that insight. Our next question is, it's kind of tied into that just a little bit, in that students are wondering and are curious about whether or not they'll be able to leave campus after they move in. And I know you tried to address that a little bit in that previous question. I'm guessing maybe asking if you could possibly expand on that just a little bit, maybe even thinking going the days leading up to campus starting, or even the semester starting, maybe that first weekend, maybe having the ability to go back home, or should they stay or try to stay with us, as you mentioned, as a part of your previous answer?
So we recognize that this is a little bit of an art and a little bit of a science. So the reason why we're recommending that once residents stay with us and check in, we know there's a possibility that if residents go back home and they go elsewhere, there's less control there. And that initial test that we administered when they arrived on campus, well, what does that mean now? We don't really get a true sense of what their status is. Now, does that mean that upon arrival and upon checking in, residents are not going to be able to leave their room? No, that's not the case at all. However, we are going to encourage residents to hold themselves to the highest safety standards based upon the education and guidance that we will be providing them and that we're receiving from our medical professionals. Making sure they're minimizing their interaction with others, making sure that they adhere to 6-foot distancing, making sure that they're wearing their mask indoors and in places where they may be around people. So what does that mean? Does that mean that they cannot leave their residence hall or their room upon checking in? Unless we find that somebody is testing COVID positive, that will not be the case. For an overwhelming majority of our students who move in, we are asking them to conduct what we're referring to as a relative quarantine, which means that just adhere to the 6-foot distancing, washing your hands, wearing your mask, paying attention to your health if you start attributing any symptoms, and really limiting exiting or going anywhere where there could be crowded areas, especially for those first 14 days as you return back to our community, so we can get a really good assessment or sense of your COVID-19 status. So if you have to go to, so for example, if you need to go get the grocery store, you're more than welcome to do that. You can do that. If someone has to, for some odd reason, they have to go home because we recognize there are things that are outside of our control, we prefer that they stay here. But if they have to go elsewhere, we're telling them to be really mindful of making sure they're not putting themselves in any position that's going to render our COVID test upon checking in. It's not going to have the same weight, all right? So you will have the ability, you will not be quarantined and isolated. You will be asked and expected to exercise good judgment. And that's the most important thing, exercising good judgment if you're going to leave out your room or your community and you're going to be out in a larger public space. Hopefully that's helpful.
Thank you, Arian. That was helpful, at least for me. Thank you. If UCF were to shut down and force students to return home and away from campus, would we be refunded? And if so, how so?
I can answer that. Yes, thank you. At this point in time, even if the university was to go completely remote, online, we have no intention of closing the residence halls. So that's not a consideration at this time. We would remain open and you could continue remotely living on campus.
Thank you, Peter. Next question. How long will the COVID-19 test take before check-in for UCF dorm move-in?
Chantel, I'll take that one. We've been working very closely with Student Health Services to estimate how long it will take to get through the drive-through check-in process, which also includes testing. And right now, from the information that we have been given, it could take up to 5 minutes to, once you get to the space at the spot where you're checking in for your COVID test, and actually the test is done, it's a total of 5 minutes. And so following the test, it could take up to 2 to 4 days to receive those test results back. And so going back to what Arian had shared, we do ask and encourage everyone to kind of relatively quarantine, keep yourself, and consider the health and safety measures that we've been speaking about and the university has shared for the first 4 days until you get your test results back. But right now, we believe it'll take 5 minutes once you get to the check-in point for the test, and then you would proceed forward to check in, receive your key, get your card encoded, and get your welcome kit from us.
Thank you. You expounding on that and just giving a little bit more insight. The next question is this. Do only the students get tested for COVID, or do their parents get tested as well if they are helping the student move in?
Very good question. We are testing students only. We do ask everyone in the vehicle if they will come with their facial covering. We do at the university, it's required for all students to have a facial covering. And so we do expect those who are helping their student, whether it's parents or anyone within the family or friends, only two, that everyone will be wearing a facial covering. And so, so only the students will be tested.
Thank you for that clarification. This next question may be going directly to Arian, since you've somewhat alluded to this and kind of shared with this about this earlier, and or possibly Dr. Konvalinka. it asks, if you move your child in on Friday, can you return to their dorm on Saturday?
So that's a great question. And, you know, this is one of the differences for the move-in we'll be experiencing for the upcoming academic year for 2020. Normally, we understand and we recognize that parents, family members, loved ones, after moving their new night into our communities, they may want to come back. As you can imagine, what we're trying to control for as best as possible is the movement of individuals in and around our community, so we can ensure that, you know, the wellness of our residents and our staff members. So we're asking that once you move your residents back into campus, unless it's an emergency, you're not returning to the halls. And if you do return to the halls, we're going to have expectations on all visitors wearing masks when they're in the buildings. So that's a really good question, and it's not that's not a yes or a no. That's a more of a help us maintain the integrity of our residential communities by minimizing the number of people who are going in and out. And that would include loved ones. Now, I would encourage residents, if they want to spend time with their family members, there are a number of different things they can do on campus or around campus. I would encourage that. But I want our new Knights and our families to be aware of the reason why we're asking to be mindful of returning back and entering into the halls is really in line with the way in which we're developing our move-in process. We're developing a move-in process based upon move-in appointments because we want to limit the amount of people who are in these buildings. So hopefully that's helpful so you can make some informed decisions and help us in maintaining the health and well-being of our residential communities.
Thank you very much, Arian. Next question, and it's a couple of questions kind of put together. Can students check into their dorm for fall semester and then work online from home until the COVID numbers go down? Second, is there a housing policy that requires students to be living in their dorm full-time this semester?
So I can answer that. Right, as of right now, our housing policies require that our residential students are enrolled full-time. You asked a very good question, and I'm going to give you the best answer that I can. So they need to be full-time enrolled to be eligible to live in housing. How much time residents are spending in housing is not something we've traditionally tracked. Of course, we do have activities and engagements, and we monitor our residents so that if, say, Arian, a new night, is not around for a week, their RA is going to be aware of that, and they're going to bring that to their supervisor's attention. So we make sure that resident is okay. But we're not tracking the daily going and comings of each of our residents. So you need to be full-time enrolled to be eligible to live on housing campus. But this year is a little different, right? So I understand what you're asking me. You're saying, do I have the flexibility to move my new night in and bring them home for a period of time, the whole semester? But our guidance and the answer to that is yes. Our guidance, what we're asking you to do, and this is an alignment and it makes sense logically, that if we're doing all that we can to minimize the amount of people going in and out of the halls upon moving and throughout the whole semester, because we recognize COVID-19 can be very contagious. Once somebody leaves our campus and goes somewhere else, it is imperative that they are exercising the highest form of judgment so that they're not putting themselves in a position and then bring something back to the halls and we have a different situation. That's why it is our recommendation, and you're going to hear us say it over and over again, that once you move in, we would like you to stay with us. However, we recognize that families are going to have to make decisions for a lot of different extenuating circumstances. Our recommendation, you move in, you're going to stay with us. We're going to make sure you have a wonderful experience for the whole fall. And we're trying to control for, we're trying to do as best as possible to maintain the health, well-being, and integrity of our residential communities. And that's really minimizing movement for the time being. And hopefully we're in a different space entering into the spring semester. But for the fall, this is what we think is best. And these are our recommendations.
Thank you, Arian. This next question expands the focus a little beyond just the housing, the direct housing experience. And it says, if students choose to come to campus, will things like the rec center, clubs, intramurals, tutoring sessions, etc., be available with rules for safety, or will kids basically just stay in their dorms?
So those services will be available. As you heard at the top of the hour, we did have our partners share a little bit about the opportunities that will be available, and we may ask some of them to chime in again just to speak a little bit more in detail as to what some of those experiences will be. There will be lots of virtual experiences. We do know that the rec center has begun opening and will be available to our students. But I do want to just pass it over to other folks on the call that can answer that question. Justin, you may want to start.
Sure, I can take on the clubs piece. So currently the Office of Student Involvement is working with its staff and the team to develop protocol for registered student organizations. They will be operating in limited capacity depending on space limitations and regulations per the university. And so hopefully we can roll out some of that information here soon, but it is being worked on, and we will be able to have a clear answer for all of our clubs or registered student organizations, or RSOs as we call them.
If I may add on the clubs aspect, the Residence Hall Association is still going to be active this year through virtual programs. We're also hoping to do in person as best as possible in terms of safety regulations and guidelines from CDC and UCF. But we have plans to continue having engaging events for residents. Residents can get involved in their area councils, and more information about applications for that will come out soon. So I definitely recommend kind of following us on our social media just to keep up with that, because that's going to be a crucial element, because we're providing programming directly to our residents on campus. And we recognize that this is a difficult time. And so we have plans to really try to connect with residents and make sure that we are still providing the same home experience for students. We have our Meet Your Neighbor events coming up soon, so I definitely recommend residents check it out just if they are interested in learning more about getting involved on campus.
I can respond to tutoring sessions. They will be available. Virtual, as well as they will be available face-to-face. However, they will be limited on campus, and you will need to check with the Student Academic Resource Center to determine the times that on-campus appointments will be available for tutoring sessions, but they will be available.
I did want to add to my comment about the Student Rec Center, the RWC. Their venues right now that are available are all outdoor venues. And so they're working on their schedule for the fall. And so I just wanted to correct my statement on that. They are open, but it's for outdoor events only.
Thank you, everyone. The next question is really open to anyone who'd like to answer. If students live close to school, will they be allowed to come and go as they please? Anyone want to try to address that one if possible?
So I would say the quick answer is yes. If you live off campus, yes. And even when you live on campus, yes. Back to what Arian had shared earlier, it's extremely important that everyone, and not just students, but staff and faculty are following the health and well-being measures and strategies that the university has put forth, that the CDC recommends. And so yes is the answer to that question. We just encourage everyone to be aware of their surroundings, and also ensuring that they're wearing their facial covering, that they're keeping the 6 foot social distancing, washing their hands, and really taking into considering the health and well-being of those around them and also themselves. And so, yes, we certainly want students to engage on campus and around campus, but be conscious and aware of how they're doing that.
Thank you very much. Next question, UCF Food Services. This will go to Wendy or Crystal. Can you tell students what food options are available for early move-in?
At this time, we are working very, very closely with our university partners to determine what should open and when it should open. And so as soon as all of that is finalized, we will have that posted on ucfdining.com, and obviously look for updates too on our social channels.
Thank you, Crystal. Next, will there be extra housekeeping services due to COVID, more than a weekly visit?
So housekeeping services, yes, there will be additional cleaning that will be taking place in our residence halls. And so there will be daily cleaning of all high touch areas, not only at move-in, but throughout the entire year. We do have, most of our spaces on campus do have someone that comes in and cleans the bathrooms once a week. And so in our community spaces, we will have our team, the university maintenance and housekeeping team that will be in our community cleaning and taking care of the high touch point areas. We will be, if anyone has any concerns or issues, then they can certainly turn in a work order to us, and we will address those. At any point in time, a student needs to be relocated because of they tested positive. We will come into that space and determine if decontamination needs to occur or if a disinfection needs to occur into that space. And so we do have steps in place to address those as well if a student test positive or if there is a quarantine situation. And so we do have protocol in place to address that.
Thank you very much, Dr. Konvalinka. The next question will be directed toward Aramark, so either Crystal or Wendy. Are meal plans beginning when early move-in begins, or will it start with the academic semester?
This is a great question, very common question for me these days. As of right now, meal plans will start on August 21st. But to align with my other answer, we are consistently evaluating this with our campus partners in the university to make sure that we are considering all factors and making the best decision. So if this changes, this will definitely be communicated out to the community.
Thank you very much, Crystal. This next question, not sure who would be the best, but please feel free to chime in, anyone. Why is UCF not using a rapid COVID test at check-in and using the longer to return results test? Dr. Schaus,
Yes.
I don't know if you can provide some insights to that one.
Sure, I'd love to respond to that. We've been partnering very closely with Aventis Biolabs, and that's who we're going to continue to work with to try to set up the initial testing. And they use the PCR molecular test. We like that test because it's the most accurate test out there. Unfortunately, with COVID and the development of testing, and I think these stories have been in the media quite a bit, you're trying to, you sacrifice convenience, rapidity of return of results, and accuracy. You have to decide which you want. We always err on the side of choosing the test that is most accurate, and that's the PCR test. It's the diagnostic test for COVID. It's actually looking at the molecular composition of the virus and testing for that. It's the diagnostic test, best test. So that's what we've chosen. It's the best and most accurate. In terms of rapid point of care testing, as we refer to it as point of care, those tests are out there. And there have been many stories in the media about the high number of false negatives. And that's reflected by a biometric of the test called the sensitivity of the test. So if the test doesn't meet a certain high level of sensitivity, it's going to lead to false negatives. And we do not want to be doing mass testing and not get accurate results, telling people your test is negative and here they are, they've got COVID. So we don't want that situation. And that's, unfortunately, I wish there was a test that we could say was as sensitive as the PCR and rapid and convenient and returned results immediately. That would be, we may be there in the future, but we're not there right now in terms of the testing technology.
Thank you very much, Dr. Schaus. This next question is going to be again directed to Aramark, so either Wendy or Crystal. And it says, are meal plans beginning when, I'm sorry, not that one. Hi, UCF team. So they're talking to everybody on the panel, everyone, but specifically to Wendy and or Crystal. If dining halls will be at half capacity, how will demand spikes be handled at the popular times? Second part of that question asks, it seems that if one is to pay for the plan, that they may not be able to utilize it as flexibly as the pricing of the plans dictates. I see this as a real concern. I'm hoping this can be addressed. So either Wendy or Crystal, do you have any insight?
Yes, I do. And I'm going to answer that question in the same two parts that it was listed. So yes, the dining hall is going to be open at a smaller capacity, which is honestly the most safest way to open for our UCF community. And we know that this may, extend the wait time for our students. And so in this case, for our peak times during our lunch periods, we are going to offer a grab and go meal that the student can swipe in a separate area, swipe for their meal, take that grab and go meal, and immediately exit to the side. And so this will give the students the ability to come and get their lunch during their peak time and not have to feel like they're waiting longer than they would. But I also want to say that we are redesigning our dining hall experience to give our students the best experience, honestly, that they can experience in the most healthy and safe way. And so while there will be social distancing, we are going to be serving all of the food to our students. We are, going to have offerings that are, offer a wide variety of what the students are wanting so they can quickly go into the lines that they're looking for. So we are not anticipating this to drastically change from the experience they would normally when they go through the lines. We are implementing that peak time grab and go to kind of help with that. Secondly, will the students be able to utilize their plans the way that they are explained for use? This is not really going to change either. We are, like I said, opening our dining halls back up. We are opening our restaurants on campus. The use of meal swipes in the dining hall is really designed to give students the ability to eat when they want to and where they want to. And so this isn't a situation where they have to come in and, eat everything that's in front of them. So if they want to come in during slower times and grab a snack, the access to go in and have as much as you want or as little as you want is not changing. And so really the changes that we are making are more for the safety and the health of our guests. And we are not planning on changing how our program runs.
Thank you very much, Crystal, for that insight. This next question, Dr. Schaus, you may want to chime in a bit. How often will students be able to get tested for COVID on campus if they feel sick? How will students be monitored on campus for COVID? What happens if a student is identified as COVID positive during the semester? And please let me know if you want me to repeat any of those questions.
Yes, we plan just an initial test. In terms of routine screening of our population, we wanted to know upfront, right from the beginning, what is our incidence of the virus of those coming to live with us here at UCF. So that's going to give us some great data right up front. And then after that, it's going to be very much on a case-by-case basis in terms of symptomatology, potential exposure, any high-risk situations that might have occurred. And then at that point, you could be retested. We are offering a lot of telehealth visits. We have a large number of providers here at the health center. Throughout the summer, we have been physically present here at the health center. We've been open. Most of our business has been telehealth visits with some face-to-face visits as well. So we would encourage students, this is part of your health fee, you have unlimited number of telehealth visits or face-to-face visits if that's the case. We do not see patients that have COVID symptoms here at the health center, but we would refer those out or would be appropriate for a telehealth visit. So at any point after your initial test, let's assume most of our residents, of course, are going to test negative. And when they get that negative test, should they then develop symptoms, you would make a telehealth visit. We could retest you at that time. And then those that are, the second part of the question asked about isolation and quarantine. We follow CDC guidelines. We work very closely with our partners at Orange County Health Department. So anybody who tests positive will be placed, that's isolation, and they will be in isolation for the defined period of time, typically at least 10 days if you remain asymptomatic, and 10 days since the time of the positive test, and 3 days without symptoms. That is a time when we typically release quarantine at that time. But that would be at the recommendation of either the provider or the Orange County Health Department. Those that get tested and think they had a high risk exposure would be in quarantine. If you're asymptomatic, we use the term quarantine. If you're symptomatic, we use the term isolation. And quarantine has very similar restrictions. You're in your room. Most of the time we would say stay within your room. If you leave your room, then you're in face covering, 6-foot distancing. That's what the quarantine experience will be like. But we work very closely. We keep track of each case. We have a spreadsheet that we maintain. We do the contact tracing with the UCF students. We work very closely with Dr. Kovalinka and her team at housing. When there are housing issues, people need to be moved. They are immediately involved. We protect roommates, notify roommates. There is some rules about notification. We follow the policy of Orange County Health Department and make those notifications in a confidential manner, but roommates are notified. And typically, that if they're asymptomatic, they would be in that quarantine situation, having received a recent news that they had exposure to a positive case, then they remain in quarantine. So we have that all carefully worked out. We've been working this protocol all summer, and it's worked out very well. We have a very good team of nurses that do our contact tracing, and then we work with Orange County Health Department. They have been very overwhelmed. We've had a very high incidence of cases in Central Florida. Orange County, they're stressed. Their resources are very stressed. But we've met the needs of our UCF community, both students and faculty staff that have tested positive. We've been able to meet that need by the dedicated staff of providers and our nursing staff. Was there another part of the question I didn't answer? I think
I was just going over just to see. I think you answered all three of those questions that were combined into one, but you're probably going to need to talk a little bit more regarding this next set of questions, but we're also asking that housing staff chime in as well. So I'm going to read these series of questions, and then you all can decide how best you want to move forward with providing the information. It asks, what will happen? And it asks you to expand a little bit more, Dr. Schaus, on what you were talking about in regards to quarantine and isolation plans. But it asks, what will happen if housing becomes a hotbed for COVID-19 and a considerable amount of the population contracts the disease? What plans are in place for quarantine/isolation, and how will quarantine rooms be distributed if positive cases use quarantine rooms approach maximum capacity?
Yeah, great question. And I hope that doesn't happen, but I sound like a broken record repeating Dr. Fauci, who sounds like a broken record. And that is, the virus will dictate our actions. And if we find we're a hotspot, is the term they use, Orange County Health Department will help us identify whether or not we're a hotspot. They'll help us identify whether this meets the definition of an outbreak. It doesn't take much to be an outbreak, by the way. CDC defines an outbreak as the initial index case giving the COVID to 2 other people. And that could be 2 roommates. You could have an outbreak in one suite of people, and that would be an outbreak. If there's then multiple suites along a hallway or an entire floor, I would think that would be an immediate notification to Orange County, and their team of epidemiologists would help us to determine if that housing unit might need to be closed. Those would be determinations we would make with the professionals in the field of epidemiology. I'm a family practice physician. I'm used to seeing patients one at a time. I've recently got expertise in some population health, but we look to Orange County for the epidemiology decisions. So what that question's really getting at is, what is the definition of an outbreak? What's the definition of a hotspot? When will we make a decision to take action on that? And that would be very closely in concert with Orange County epidemiology.
Thank you, Dr. Schaus. If I may, I would like to piggyback and connect in very salient ways what he just said. One, we're hopeful that, UCF, nowhere on UCF becomes a hotspot, including but not limited to housing or residence life. But we recognize the potential of that is there if all community members are not adhering to the guidance and education that we're putting out there. So we're going to circle back to the earlier questions. Can we leave campus? Yeah, but we recognize how infectious this particular virus is. And we also know, not your children, because I'm sure you have a household where if you give advice to the younger members of your household, they adhere to it. Unfortunately, I was a different type of younger person. So even when my elders told me not to do something, I may have done something differently, right? And we see this happening in social media. We see them saying, oh, I'm not doing anything, but we quickly look at their social media and we can see them surrounded by 15 people. And then they're coming back to the halls. And then next thing we know, 3 people are testing positive for COVID. That's why we give you the guidance of, can you? Yeah, you can, but we would rather you do not. And we need people to exercise really good judgment, because no matter how hard we work, and we're going to continue to work very hard to put these plans in place and to ensure the health and well-being of our students and our staff members. The plans are only as good as the individuals who are adhering to expectations. And we don't have enough staff members to do a one-on-one for every one of our students or residents. So we're going to expect them to exercise some good judgment, to exercise good judgment when we're not in that space. So, but Dr. Schaus is correct. We've been working through and on a plan and protocol that's been working very well on campus. In the event that somebody is brought to our attention that needs quarantine and isolation, so we can mitigate the spread of the contagion. So, but really, it's a community effort. It's a shared responsibility. So, and that's important for us to communicate both to our new and returning Knights, but our family members as well.
Thank you very much. Will the no visitor rule be enforced?
Yes. We will expect people to adhere to no guests and no visitors. Again, we're putting these policies in place to do all that we can to control for these environments, right? So we recognize guests and having guests is a wonderful element during normal times, but we're not in normal times right now. And we want to make sure that we are maintaining the health and well-being and integrity of our halls so we don't have any hot spots. And, our Knights listen to us because they're brilliant, they're intelligent, they understand the complexities and the importance of following directions. But sometimes guests or friends that aren't Knights may not have that same understanding. So we know what we're communicating to our residential population. We know what we're communicating to our students at large at UCF. We can't make the same assurances for people who may not be connected to our institution or institutions that we work closely with, like Valencia. So yes, we will be enforcing no guests. And, we plan on having really good educational conversations, 1, 2, at most, with our residents when they're not adhering to those expectations. So we could realign expectations for all of the reasons that we're stating and talking about right now. And moving closer to the spring semester, hopefully, if things start looking very different, we'll start revisiting some of these policies that are in our addendum and in our community living guides to see if we can relax some. But as Dr. Schaus said, the virus and the data is really going to dictate how we move forward.
Thank you, Arian. Next question. Will there be in-person events, including football?
Very good question. And I think we're all waiting to hear if there will be football in the fall. So I wish I could answer that question for you, but right now I think all of us on this campus are anxiously awaiting the announcement. I think the plan right now is to proceed forward, but we're still waiting. And as far as other events, Justin or Curtis, you want to speak to the other part of that question?
Sure. As I mentioned earlier, currently we are in Summer B, and through July 31st, we have a slate of virtual programs occurring from various student organizations and campus departments. Again, you can refer to those on the OSI website under summer events. And for the fall, we are looking at having very limited capacity in-person social events, but really looking at the virtual option or the hybrid option. And as I mentioned before, we've had virtual speakers this summer, a trivia night, bingo, an escape room, all virtual. And we've had some pretty great attendance, and it's a good way to interact, with your peers in the state that we're in currently. But for the fall, we're going to continue to explore those means, and then hopefully try to provide some in-person events as safely as possible with facial coverings and social distancing in place.
Yeah, similarly,
Go ahead.
Residents Health Association is just going to wait for more guidance in terms of what the guidelines are going to look like for in-person events. We're really hopeful that we can do some sort of in-person events so we can still get to interact with students. But we are going to definitely stick and make sure that we are keeping our residents' health and safety at the forefront of things.
Thank you, everyone, for your insight. We are getting close to our time, so we'll probably try to get to either one or two more questions based on the depth and the brevity of the questions themselves. So this next question will probably go a little to Dr. Schaus and then others who, if you would like to add in, you may. If students test positive at check-in, they have already lived with their roommates by the time they find out the results. Are they then quarantined in their own room with their roommates? It doesn't make sense to then separate out one person to live in isolation.
Well, what will make sense is the direction that we get from the Orange County Health Department as well. If we do start seeing a lot of cases, a lot of positives that come out. An important concept is the concept of source control. So how is COVID primarily transmitted? It is primarily transmitted from a symptomatic person who's coughing or sneezing, and then those are what's called respiratory droplet transmission onto others. That's the main way it is spread. But here we are in this situation, and Arian talked about the importance of everybody right after testing being in partial quarantine. So here you are, you've been tested. Initially, as you come in, you're at mask, face covering. So you're in what we call source control at all times when you're out of your private room. And when you're interacting, you're maintaining a 6-foot distance. Therefore, there's not going to be the exchange of the virus with roommates, even if you were to be positive. So if we adhere to those principles and we are adhering to the partial quarantine after testing, even those that are positive, it would be very unlikely that they would then be spreading it to roommates. As contagious as this virus is known to be, just equally strong is the effectiveness of those public health measures that I just mentioned. So face covering prevents source control. 6-foot distancing prevents spread of the virus. So I think it makes a lot of sense that we would test. If someone then were to be positive, we would put that person at that point of knowing they're positive in isolation. That is what the public health department recommends that we do. And then taking those roommates that may have had exposure and putting them in quarantine. But it would be unlikely. I think if everybody's doing the right thing and adhering to those recommendations, it would be unlikely that we'd be experiencing spread from those few positives that we're going to get at screening onto the rest of the roommates and other areas of the residence hall, or even elsewhere on campus if they're, interacting anywhere outside of their residence hall. So I think it does make a lot of sense. I think the fact that we're doing testing up front in the high-risk population is consistent with the recommendations of the American College Health Association for those in residence halls and congregate living. They're high risk. We're worried about that. And we're doing that recommendation of testing. And then the testing leads to those actions that are very well established by the Orange County Health Department. So it makes sense.
Thank you very much, Dr. Schaus. Appreciate you providing that insight. That is going to really conclude our time right now for being able to answer questions. So regrettably, we won't be able to get to every question in today's format and in today's forum, but we will capture these questions and make every effort, I repeat, every effort to answer these in a follow-up communication. Would Dr. Kovalinka like to give us any final comments?
Sure, thank you, Chantel. So just so you know, the university remains fully committed to the success, health, and well-being of your student. All of us have a shared responsibility, which we've talked a lot about today, to protect the health of our community, and that means changes in our behaviors. This town hall was part of our effort to make sure everyone has a clear picture of what you will expect and experience this fall. As a reminder, students need to continue checking their email for further information. Many important updates in regards to move-in will be coming shortly. As Meredith indicated earlier, you did receive information regarding move-in times yesterday. We are working hard to support your student success, and we want to make sure all of you have a great semester, and I hope that this information that we shared today has been helpful to you. We look forward to seeing you in the fall. Go Knights.
Thank you, Dr. Kovalinka. At this time, I would like to thank all of our panelists for today. Thank you so much for being present and being visible and being here with us to allow our community to be able to ask you engaging questions. I want to also thank our audience for all of their engaging questions. Thank you for being present with us as well. We appreciate the connection and the opportunity to be with you today. If you have any additional feedback, please email housing@ucf.edu. Again, I repeat, housing@ucf.edu. Our closing screen will include links to additional resources that you can check out. You can find a recording of this event on UCF's YouTube and also Facebook pages. So this will conclude the Housing Fall Experience Town Hall Forum. We hope you all have a wonderful and fantastic day. Go Knights, be safe. Thank you very, very much.